and gentlemen, welcome back to another episode of We Talk Talent Season 5, where we host renowned HR leaders from across industries and ask them to share with us their best practices and strategies that they have been implementing in their organization to cater to the ever evolving needs of the workforce, and workplace. Today, I am thrilled to have Narayana Health's Head of Talent Acquisition, Prem Anand, on board with us today for this episode. Prem comes with over 2 decades of global experience in HR and has been in roles covering talent acquisition, HR partner, and talent management across technology, BFSI, and healthcare industries. He is passionate about people development and is also a certified coach. He is currently heading the talent acquisition at Narayana Health, which is one of the most respected healthcare brands in the country, wherein he is invested in achieving its strategic people objective. Welcome, Prem. It's a pleasure to host you today.
Thank you so much, Nilanjana. Pleasure's all mine.
All right, then, let's kickstart this episode with my very first question, Prem. Since we know that almost every industry has gone through massive changes and challenges, right? So healthcare has also been one of those industries. How has your industry been tackling these challenges that the workplace has gone over the past couple of years?
So I think when we say a couple of years, I think there's a marker. We have the COVID year, which was pretty much a turning point for all industries, including healthcare. And what we saw during the COVID years was that, even the healthcare industry was not immune to these changes. So we were also impacted. The healthcare industry was impacted because we were just unprepared for what hit us all, right, across the world. So that prompted a lot of thought in terms of how we handle our services better, how we handle the keyword pandemic, which came along, how we handle all of this better. So it demanded new skills. It demanded new ways of working. So obviously that became the marker year for all of us, and it resulted in a lot of changes. While the rest of the world adopted work from home as a way of continuing their services, healthcare obviously does not have that luxury. It is patient care at the site, but at the same time, it also did not mean that we couldn't adopt technology. So I think one of the biggest changes that has hit the healthcare industry also is technology. So both in terms of the clinical side of it and also from a delivery standpoint. So whether it is your non-clinical services or even from the employer standpoint, I think there was a lot of change in terms of how technology brought disruption into the ways of working. So what we started seeing was technology played a big role in terms of how we had to deliver our services. So which means new skills like AI, ML, IoT. So these are new keywords for this industry, but it's not an industry which is averse to technology. I mean, we've always innovated. The medical fraternity are possibly one of the most technologically advanced set of people on earth. There have been innovation in medical care, whether it is the way that surgeries are performed or diagnosis is done. So there's always been technological innovation and disruption that's happened. So what was required was for the rest of the services to keep pace. Yep. So in that sense, I think there were new skills that were required to be brought into the workplace. So that's something that those are some of the changes that have come up in the workplace in the last couple of years.
Great. Thank you so much, Prem, for sharing that. And we all can, I think, resonate with the fact that technology has been the biggest, I think, the catalyst in terms of the change that is happening around across industries, and obviously healthcare being one of the most dominant and prominent industries. And COVID made us, realize even more the importance of this particular industry as a whole. So when I'll pick on the point. I'll rather skip the second question as of now and move to my third question rather, because we talked about skill sets, right? Skill sets right now, when there are technological advancements happening, there are a lot of soft skills importance is also seen. It's on the rise in a way. So how do you see the importance of soft skills evolving, in the future going forward in your industry as a whole?
I think uh, I think it's just a matter of time that that will be the only skill that humans will be left with to deliver,
Yeah.
because a lot of the other skills which we might call as hard skills or technical skills will all be managed by AI or some form of process automation. So there's automation on all spheres of work that we are involved in. So automation is going to remove a lot of the work that we do currently,
Mhm.
which leaves us with just the soft skills, which is probably the most important thing that we can deliver. So whether it is leadership skills, whether it is negotiation skills, whether it is decision making, while decisions can be made by machines, there are probably it's going to take a while before life saving decisions or key decisions based on varying parameters. That will be a domain that humans will still hold. So I think in that sense, we as employees will be left with only soft skills to be able to create an impact in the changing world scenario.
Yes, very rightly said, Prem, because I think with technology, Gen AI and AI, becoming everything that is robotic or maybe technologically advanced, this particular skill set, having that particular decision making skill set, or maybe the leadership skill set, or soft skills overall, will really hold importance. And keeping the humanness intact is also one of the things that we all will be looking forward to it, right? All right, then. This takes me to another different question, rather, I would say, moving towards from skills to a little bit of employer branding, if we have to talk about, because employer branding as a strategy, as a practice, has seen a lot of changes in across industries, and I'm sure healthcare, I'm sure Narayana Health too has revamped their employer branding strategy, if I have to share. So could you shed some light on the employer branding strategy, and how has this evolved in the past few years? And since we know it's really important for the potential candidates joining any organization, so how do you see that particular strategy evolving and the importance evolving as a whole?
Maybe what I'll do is I'll try and break this up into two parts. First, touching upon our brand strategy as an organization, as Narayana Health in itself. So, what we've done in terms of our brand repositioning. Um, so we had a recent change in our logo. So prominently, it was just the logo from an outsider's perspective, but that also connects to our brand promise and our the way that we wanted to reinvent ourselves as a provider of healthcare services. We're a 20 just a shade over 20 years old company. So when Dr. Devi Shetty first started the institution, it started off as a single specialty a center for cardiac sciences and cardiac care. Um, and today, as we stand, we deliver over 30 plus specialties. We have under our fold, multiple different subsidiaries which deliver and cater to different healthcare services. So, for example, we've recently got our license for a standalone health insurance player. So we are in the health insurance business. We are also into integrated care, which provides end-to-end health services on the primary healthcare side. We also have what is unique to the healthcare industry. We have uh, a product company. We are a software development company in our fold, and also an analytics company. So these go by the name of Atma and Meda. So while we have multiple such brands within our fold, we wanted to have a unified, brand presence. So we created Narayana Health as the mother brand, and we have all of these services, whether it is labs, whether it is pharmacies, whether it is technology, whether it is integrated care, insurance, all of it under the same umbrella. So we did a lot of innovation. So in order to be able to, attract the skills that were required for all of these new business lines, we had to obviously be able to attract talent from across industries and not just limited to the existing healthcare or the hospital sector, because a lot of these skills were outside the industry. So whether it was hiring our CFO or our group head of HR or even our chief marketing officer, all of these people came from different industries and brought with them new skills, and that's what we are continuing to do. So we need to bring in new skills, which means that we needed a brand new positioning of our organization, that we are not we are an organization looking for growth and innovation, and that required new skills, whether it is digital transformation, whether it was digital adoption, and a lot of techno-functional experts were required for all of the new technologies that we were bringing in. So in order to do that, we had to revamp our employer branding strategy, that we are not just a healthcare company. We are, an organization with a career for various roles, not just limited to clinical or clinical related services.
Great. I think thank you so much, Prem, for bifurcating it into two different parts and taking us through this depth of how Narayana Health has probably revamped the employer branding strategy or the brand position as a whole. Because maybe for some viewers or maybe some potential candidate, they might be thinking that okay, maybe it might not have that right kind of career opportunity available for me, so might I just well not apply. But maybe who knows that there might be a lot of other opportunities involved, right? You rightly mentioned about like the CFO, like the finance department, the marketing department, and the HR department as a whole. So great, guys, thank you so much for sharing that frame with us. This now brings me to one of the the aspects of the generations that we are catering to, because obviously different generations have a different mindset about the organizations, and I'm sure this particular generation that I'm talking about, everybody talks about it, is the Gen Z's that we are talking about, right? So what is your take on this new generation, the Gen Z's entering into the workforce, and how do their expectations differ from those of the previous generation? And I'm sure you have had that kind of experience in dealing with different generations, their expectations, the millennials, and all of that. So could you tell us about it?
Absolutely, and being responsible for the talent function, it's probably most important for me to keep pace with both ends of the spectrum, because we need the experience and the knowledge that the older generations carry, and we need the next set of uh, uh, the current generation or the Gen Z, who will go on to become leaders in the future. So obviously, they're just as important to us as anybody else, because we need leaders who we are able to groom from the grassroots level. So when it comes to the Gen Z, what we've, at least I would speak for myself, what we've observed is they're probably they're far more confident than any other generation was in the past. They're pretty well informed, which means that they have access to information and they use it to the best of their advantage. See, I think the most simplest examples would be, I think we've come out of that this one of remembering things or learning by rote and memory. So this is a generation that is very adept with technology, and that's what we need. So we're not shy to look at people who have chat gpt skills, because we need solutions. We don't need people who will go and think and then confer and then come back. We need solutions uh, which could involve both being able to mine the data that is required, as well as being able to interpret it and analyze and present it. I think this generation is most adept at something like that. Yeah, so I think they come with all of those skills. The one thing that probably we would be most worried about is the levels of patience that pretty much runs low with the Gen Z. But I think they're supremely self-confident, which is a very important trait. So they're an asset. It's just that organizations need to adapt to how the Gen Z thinks and operates. As long as they're able to contribute, it's 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 time to change for us as well.
Yes, I absolutely agree to the point wherein you said that they do come with a lot of hacks and advancements already. I mean, I coming from a millennial generation, still might have to, probably just think of old ways of thinking, maybe. But still, I'm sure there's a lot of learning coming in from this generation, and I'm sure our viewers who would be from this generation would be nodding their heads that yeah, I do have that kind of skill set that you might be looking at. But then yes, rightly put forth, and yes, patience. I hope Gen Zs might just also want to adapt something from us, that's patience, and we might also want to adapt these kind of hacks and smartness from them. Thank you for sharing that. This brings me to the last question, Prem, which would be very specific to the talent acquisition space as a whole. So like you mentioned, a lot of challenges that comes in, that challenges in terms of expectation, how they might be paid, for example, or they might be having a kind of culture, or are they learning experience, or the employee experience as a whole being provided rightly or not. So could you share with us some of the most prominent challenges that you face in this talent acquisition space and your strategies to overcome it?
Right. Specifically, the healthcare industry is unique in many ways, right? Um, so we have four groups of associates. We like to call them associates here, because we have three groups of employees, and one is our consultant base. So our doctors, who are the bread and butter of the organization, are largely consultant doctors who can be on full time engagement with us, or who might be engaged with us on a visiting consultant basis. So that's one group of associates that we have. The others being the nurses, which is our largest group of associates. Then we have the technicians or the paramedics, and finally we have all of the support functions, which we uh, group under the category called admin, which essentially is all of the functions, whether it is technology, HR, finance, supply chain, marketing, all of these put together, and the operations staff on the ground. So all of these people put together form the four groups, and this is the set of people who deliver healthcare. So three out of the four groups of employees are patient facing, right? The doctors, the nurses, and the paramedics. So obviously, these are people who come with professional skills. They are professionally qualified, certified, and hold licenses to perform their functions. Which means that we have to be able to attract the best of the doctors, the best of nurses, and technicians. Um, and it's a limited pool that's available, because given the given the requirement that is there for healthcare, the demand and supply gap, I think that there is always a supply side, constraint in the healthcare workers, especially if you take nurses. It's a big challenge that not just Narayana, it's all of the hospital space because so what happens is healthcare touches every single person on the planet, which means that healthcare is required across the globe. Every single country needs it, and very few countries actually produce nurses. So that means that there's a lot of opportunity for our nurses to move abroad when they've kind of gained sufficient skills. So there's always a constant outflow of trained nurses in the country, which means that that's a constant challenge that we face in terms of being able to bring in new nurses, train them, and then put them across for patient care. So that's one area that we perpetually face a challenge. Now, on the admin side, we were talking about technology. We were talking about new ways of working. So that demands new skill sets. We need people who are tech savvy. We need people who have skills like whether it is function skills like using HRMS platforms or finance platforms or supply chain systems. All of these things are now on cloud-based platforms. So we need those skills to be able to operate those systems and deliver the same kind of services that is expected out of these associates. So attracting people with these skills, which is not is very I mean, like it's an industry that's evolving, so these skills are very limited in our within the industry. So which means that we'll have to attract this from outside the industry. So going to somebody in a technology company or in a FMCG company and pulling him towards healthcare would just confuse the person as to what would I do in healthcare? How does it fit into my career scope? So that's a new challenge that we're facing, and we'd like to overcome that by talking about skill-based roles for the future, and because these roles are industry agnostic. Really, if you look at HR skills or finance skills or technology skills, they're industry agnostic. Those are skills that will deliver in any industry for that. So. So we're looking at how we brand ourselves as an employer and so on. So that's the way that we're looking at overcoming some of these challenges.
Great. Thank you so much, Prem, for sharing these two challenges. And I'm sure there has been a lot of changes that Narayana Health earlier used to cater to such, and because these challenges are not something that's happening right now. It is been there since ages, and there are different advancements at every step that these challenges are being mitigated by. But right now, with the technology coming in and a lot of focus going in towards skill based hiring and all of that, so the route towards getting the right kind of talent on board will be a little different than how it was earlier. So thank you so much, Prem, for sharing that. And I think this brings to the end of the episode, ladies and gentlemen. And I hope our viewers will have a lot of learnings and key insights to take care from, because you shared about an industry wherein maybe most of the people might not get that kind of information about, but you shared it with us beautifully. Thank you so much, Prem, for taking out time and joining us today.
Thank you, Nilanjana. Thank you so much once again for hosting.
Great. All right. Thank you so much, ladies and gentlemen. I hope you all would enjoy watching this episode, and stay tuned. We will be back with another Power Packed episode the next time. Until then, take care and bye bye.